Good afternoon. I'm here today with Jennifer Krueger, who, whether she wanted this position or not, has kind of been designated the lead medical authority for Northside ISD. And I'm going to ask the first question. I know it's a little bit redundant, and the reason I say that is because we've been in this now for almost 8 months. If we go all the way back to the news from December, we've been at this now for going almost 10 months.
Yes.
What is COVID-19?
So COVID-19 stands for Coronavirus 2019, which was a new type of coronavirus that was identified and has caused a different variety of severity and illness all the way around the world. And so we've been having it here in the United States since March that we really kind of know about it being here. And so it's been a big learning experience for all involved, for medical professionals, for regular citizens, and all of that, as we've had to deal with something, and a pandemic is something that's so new. But that's really what it is. It's just a very new type of coronavirus. Regular coronaviruses cause the common cold. But this one is so new, nobody has immunity to it, and we don't have medications to treat it like we would treat other types of coronaviruses and other types of respiratory illness and other viruses and things like that. So that's why it's been something that's been very different than what we've had to deal with in many, many years as a pandemic.
Coronavirus, because it is a virus, there is not medication that you can take that will eradicate a virus. You're treating the symptoms that are there. My understanding too about the coronavirus, we've had many different types of coronaviruses. SARS was one of them. Mm-hmm. Flu itself is a form of the coronavirus. I know a lot of social media posts and everything was making a big deal out of the fact that Lysol says that it killed coronaviruses. So coronavirus itself has been around for a long time.
Yes. Yes.
Has that not helped the medical profession have a better understanding of, at least in some ways, how it will react or not react, or how it's spread, how it's not spread?
I think it probably has, especially for the respiratory type symptoms. The COVID-19 has behaved a little bit differently than a lot of the more simpler forms of coronavirus in the past that were more just the respiratory driven. So I think partially yes, but there's still so much unknown about this new one that's been kind of the challenge, and as they're working through. So as nurses, we're still learning right along with them and following guidance that comes out as they learn new things. And we know that things change pretty much daily as the type of information that comes out. So what happened last week may not be what they're talking about this week and things like that. So it's very important just to try to stay updated with the most current information, which is what we're focusing on. Even as we were bringing kids back to school, we have plans, and then as more information has become available, we've been able to adjust our plans and update our planning so that we can make our campuses as safe as possible for both our kiddos and for our staff members, as well as family members and all of that.
And I think it's important because you say as things change, and obviously the situation is evolving constantly.
Yes.
But it seems like the mortality rate has started dropping, which is good news, because does that not mean that the medical profession has a better understanding of the disease and some of the treatment methods that will help alleviate symptoms or prevent symptoms from going into overdrive?
I think so. I think they have learned quite a bit. Obviously, there's still a lot more to learn. But I think a lot of it has also that the general population has learned quite a bit also in better prevention techniques, wearing masks, washing your hands, having that physical distance. All of that contributes to having better outcomes and at every level. We know that most people, if they do get infected with COVID-19, a majority of the people have more moderate, mild type symptoms, but we do have some that will have them more serious and have to be hospitalized, and some of them end up in the ICU and things like that, and unfortunately some end up losing their lives. But I think the medical profession is very dedicated to learning what works, sharing that information to different facilities so that they can also institute things to get things do the best for the patients that are hospitalized, as well as all the research they're doing on different treatments and vaccines and all of that, trying to, with the common goal is how do we defeat this disease.
And let's talk about what I like to call the fine line, because schools seem to have to walk that fine line. Research is showing that for the most part, teens, preteens, adolescents, if they contract COVID-19, they typically experience a mild to maybe moderate case. However, if an adult, and especially an adult with pre-existing conditions, contract COVID, their results are somewhat more dire. So that's something that the district has to keep in mind, because yes, maybe a student catches it and may have a fever and a tummy ache and things get better, but if the teacher inside the classroom contracts it, it could mean a completely different way of approaching it.
Yes, so that's why our safety protocols, we've been working very hard on instituting and making sure that we educate both our staff and students on how to keep each other as safe as possible, going in and how to appropriately wash their hands. Where is a good place to stay, even with the signage that we have in the campuses, showing kids where to stand. And even sometimes adults need a little reminder too, hey, we need to maintain our physical distancing. We need to make sure that we're wearing our masks when we all know they could be uncomfortable. But it's very important that we do all of those things, and to keep reminding and keep that education going, because everybody's going to need a reminder from here and there. So we have that built into our planning, not only the actual logistics of it, where, say for instance, where is an appropriate safe spacing between different desks, where can we put physical barriers like plexiglass and things like that, but also just there's always that human piece, what we need to do ourselves in order to keep our neighbors safe, our classmates safe, our teachers safe, and family members too, because we know that our families, some of them may have just the one generation or two generations in the household, but we have a lot of families where they have grandparents living in the household, as well as all very young children. And so the education part is super important, not to our students, because we are finding that the kids are being very, when they're informed, they're not afraid to talk to people in their household. This is what we need to do, and things that they've been very proactive, and so we've been pleasant. It's been pleasant to see things like that they're being advocates for their own family members, which is great, and that's part of that whole education piece that we want to continue as we bring more kids back to school. And we also want to make sure that our parents know what we've been doing too. We have some videos that are out there. This is kind of what you can expect when your kiddo comes back to school. Doing like virtual tours, scheduling things, parents' town hall meetings if they have specific questions, all of those things, so that we want the parents to be able to make their own informed decision, that we have several different things that they can choose for, what's going to work best for their education of their child. And we're always here to answer any questions that they may have so that they can make their decision.
And so we've talked about protocols, we've talked about safety guidelines, but can we get a summation of what are those protocols that the district has put in place? What could I expect if I walked into a classroom today?
Okay, so as students walk into the buildings, and even before they walk into the buildings, our first safety protocol that we have in place is our health screenings, where we have sent those out to parents to see if their child is exhibiting any of the symptoms. The common ones are going to be the runny nose, the cough, shortness of breath, nausea, vomiting, and diarrhea in some cases. So we ask them those questions before they even send their child to school. And so that is our first line. And then at this point, we are doing temperature checks for staff members and for students as we're coming back into school slowly. And then we also have a lot of signage up there ready to go, make sure that you're wearing your mask. This is an appropriate place to stand and things like that. And then also about hand washing. And then being very clear is, what are our protocols going to be when we're in the classroom? Everybody's going to have their own device to be using. So there's not minimum of any kind of sharing within the classroom. This is where the hand sanitizer is, and this is when you're expected to use that hand sanitizer. Everybody is expected to use it as they enter into the school. and that should be placed right there in the front doors in any type of exit or entrance, as well as in the classroom. So we made a lot of planning about having that to be available. Also, even in the restrooms, where we only have a certain number of people in the restrooms at the same time. And then so we're monitoring all of that. Yeah, and what our lunch procedures are going to be, what are our recess and PE, all of those safety procedures have been put in place. Same thing with athletics and fine arts. Those specific departments have been working very hard on how to keep athletes safe, how to keep our band students and choir students and drama students, all of those, all that planning, so that we can make sure that they can still have fun as we go through and start coming back into all those activities that kids like to come to school for, but in a safer way.
Jennifer, I hate to ask this question, but elementary kids, sometimes you would have grade level recess where all third grade is out on the playground. Is that going to change this year?
It is looking a little bit different. So as they go out, they may not all be in the same area. You know, they may be separating pods of kids that'll work in a different area of the playground, and they will stagger times a little bit more than they would have in the past, where maybe not all the classes in all of one grade go out at the same time. They may stagger in 15-minute increments and things like that, just to make sure that when kids are outside, there's plenty of room for them to run around in a more spacious way. So yes, they've made plans on that.
But what I'm hearing though, and I think that this is important to stress, because we've seen the Journal of Pediatric Medicine talk about how socialization is important to students, and a healthy lifestyle for students based on socialization. I'm still hearing that there is going to be the opportunity for socialization in schools. It's just going to be, would control be the right word to use, or more directed?
Probably, I would say maybe directed and purposeful, maybe on the way that we have that. A lot of it is we're trying to focus on, as much as possible, keeping kids within the same groups as we can. A little bit easier to do that in an elementary level than it is on the secondary level, but there is still some focus on trying to minimize. We want pods and kids to be in groups and be able to socialize and things like that, but maybe just not as free-for-all as we go through this time until the conditions do continue and improve. That's what we're hoping for. But it's basically just more of a planned and directed approach to doing that, because we know that kids want to be with their friends. They want to be able to interact with their friends, and we want that too. We just want to make sure that we're doing it in the safest way as we can.
Now, will there still be class changes on the junior high and high school level?
Yes, there will be on the campuses. Right now, the limits in the classroom is going to be around 10 kids. When we first started, everybody was virtual. The next couple of weeks, we had a 6 student in the classrooms. Now we're moving up to 10. Hopefully, we make it into our metric for what we call a green zone, that we can kind of approach that too. But that's what we're doing right now.
But I mean, I won't go to, if I'm a high school student, I wouldn't go to, say, my first period class and then sit in that particular class all day long. I would still travel to my second period class.
You would still, yes.
Still travel to my third period class. So I would still get to see the different teachers, and I would also get to see the different people that may be in my different classes. So
yes,
that is still there.
Yeah, you may have an assigned seat in each class.
Correct.
But yes, they are doing. They would be going to their different class periods. That's correct.
So you talked about the matrix. So let's talk about the matrix. We've heard almost like the stoplight. There's yellow, red, green. What does it mean?
So in our metrics that we actually have 4. We have green, yellow, orange, and red. And so when we were in what we call the red zone, that was the time period when we didn't have students in class. And so we moved to orange, which is where we have our metrics of the 6 students per classroom. Yellow, we have 10 per that, and then as we move to green, we have not made it to the green zone yet. We're still operating in our yellow zone. And so what we did is we kind of mirror metrics that are set by our San Antonio Metropolitan Health District, but also we did take into account what was important to our parents. What did they want to see safety-wise be put in place? Hand sanitizer. What would the lunch protocols be? What would our transportation protocols be? All of that also had influence in, as well as CDC, the American Academy of Pediatrics, National Association of School Nurses, all the guidance that we had put together. And so the metrics that we have utilized, the city has kind of a three-pronged, where it's the red, yellow, green. We decided in ours to have that fourth level added just because we felt it was important to maybe go from zone to zone a more gradual thing rather than just in the three. So that's kind of was an important decision. We felt it would be more, our parents would be a little bit more, I won't say the word comfortable, but as comfortable as could be knowing that we were going to take a very conservative approach to start and that we would be easing students back to school in a very organized, in a very conservative way again, just to make sure that the protocols and our safety measures we have in place, that they're working. We definitely want to avoid having to go backwards if at all possible. Now, we don't have control over what the public health situation can be. As we know, it's kind of fluctuated throughout the summer. We're hopeful that it's going to continue in a good direction, because I feel like people understand what they can do to keep each other safe a little bit better now than maybe earlier in June and things like that. I feel like our community has learned a lot over the last few months.
Well, let's talk about that. I mean, I think that you hit a very important point there. We're now 14 days away from Labor Day. Today is the 14th day from Labor Day. So would it be safe to say that if we were going to experience a spike because of the Labor Day holiday, we're kind of past that scary thought?
We're getting to the part where we may be starting to breathe a little bit easier. I can tell you that we were very nervous about Labor Day, and we wanted to make sure that we were not going to be moving too quickly. We wanted to make sure that we gave our reentry transition enough time to make sure that our timing was going to be appropriate and allow for, if there was a difference in cases, either spikes or whatever, that we made arrangements to, I guess, what's the word, we just accounted for that. And we wanted to make sure, we talked a lot about that with the leadership, that we want to make sure it'd be better to stay conservative and just kind of wait and see, because we know even though Labor Day may have been on the 4th, we're not going to see it until a couple of weeks, and they were very open to that. And to hear, we're staying under a couple of hundred cases, Bexar County wide, where we would love for it to be lower and want it to be lower. We're very grateful that it has stayed within a relatively low number, and so far I haven't seen a large spike, and hopefully over the next 4 or 5 days we're not going to see that again, because we know it's about a minimum of 2 weeks, but sometimes there has been some delay as well, and we never know what could be delaying cases being reported and things like that. So hopefully we'll be continuing in that good direction.
Well, but I mean, let's also focus on a positive here too. District-wide, since Labor Day, you haven't seen a lot of staff members that have had to go out because they're feeling, sick or ill. And the students that have returned, we haven't had a lot of those students leave school because they were sick or ill.
So far, I feel like we've been fairly lucky. With this being as large of a district as we are, have we had a few cases? Yes, we have, and we've been reporting those to Metro Health and things like that, and working through, educating and doing contact tracing. All the nurses are trained in how to do appropriate contact tracing on their campuses, and then we work very closely with our Metropolitan Health District. But yes, it's. And communication with parents, if your child is sick, please don't send them to school. We've been very open with our staff. If you're feeling ill, please don't come. Let your supervisor know, and we'll take it from there. We've been doing a lot of focus on that type of communication, trying to keep our buildings as safe as we can.
I think it's important that we kind of stress this here, because as I visited with Dr. Woods, having someone come to campus that is positive, or somebody that tests positive that may have been on campus, it's a given. It's going to happen. And we've had situations already where, yes, I think there's been maybe 6 students. I know the new number will come out tomorrow.
Mm-hmm.
Has it caused a concern for the district?
We always have concern there, but in like an increased concern, if that's what you're asking, I wouldn't say necessarily an increase of concern, but more that it's an ongoing concern, and it just reminds us that we have to be vigilant always. And so we want to make sure that we are revisiting all of our safety protocols. Anytime if we have questions, we want to make sure that we're very clear. We're also making sure that we are giving consistent information. One thing I think that the district does well is a daily communication out from leadership to our campus leaders. Make sure that you're communicating this with your folks and things like that. And then also getting that communication out to our families. You know, as we get closer, as you're trying to make a decision for your kids to come back, here's what we're doing, here's what you need to know, and that type of thing. But we won't ever not be concerned. And so that when I think about the students and the staff members in our district, you know, that their safety is our primary concern. You know, we want our kids to feel comfortable. We want their parents to feel comfortable that coming to school is the right decision for them, if that's the decision they make, or if they feel more comfortable keeping their child in the virtual learning environment. We are here to support their child no matter what they decide. And we make sure that all the programs that we have in place, if they're in person, that they're going to be consistent, they're going to be safe, and we're going to continue with our vigilance and our safety cleaning protocols and education protocols and all of that. So that's heavy on our minds all the time.
And adding stress or weight to that thought process, we're about to start flu season. How can we know that I'm not suffering from COVID, but it's flu, or I'm suffering from COVID and not flu? Are there some things that parents might know? Is there something that even as teachers or staff in the district, I wake up today and I'm not feeling real well? Is it corona, or is it flu, or
yes,
just a bad meal at a restaurant?
Right. So those are all questions we're all asking ourselves right now, and questions that we've asked Metropolitan Health District, because a lot of the symptoms are very common symptoms: runny nose, coughing. All of those are very common with influenza also. And so what we try to message is that whatever symptoms that you're having, you want to make sure that you're checking in with your healthcare provider and staying at home if you're sick and things like that. And if whatever testing results, then we can follow up on that end. But we want to make sure that with so much overlapping, we may not know, especially at this school level. And so we do have safety protocols in place that if an individual is exhibiting symptoms of what could be COVID-19, could be influenza, could be a common cold, could be whatever, that we are going to put them in an isolation area to keep that person safely away from others until either a parent can arrive or someone could take them to get evaluated by their healthcare provider. And then we also have some information sheets that we send home with any students about, these are the symptoms to look for. These are kind of what kind of criteria we would ask for the student need to meet or the staff member before returning to school. And just having that open communication. That way we are hoping giving them that little bit of information at that time will help them recognize if there were any other symptoms that might come up, or if anyone else in their family or friends would report, say, hey, I've got some information from the school here. And then also a few resources if they want to get more information. CDC, the Metropolitan Health District, we regularly want to make sure that they want to do more, research into things like that they have those resources as well. But really it's a difficult question. When at this different facilities, why we want them to go into their medical providers. They can test for influenza and they can test for coronavirus and things like that. Then they can get a clear answer. And in some cases, we always know that cost might be a factor. With COVID testing, thankfully there are some free sites through the Metropolitan Health District for individuals that might be symptomatic that they could take advantage of. And the nurses are really good at putting people in contact with resources in that manner, and then also directing them to other city resources if it may not be testing related. Maybe they need rent assistance, maybe they need some other type of assistance. So we're kind of trying to make sure that we're helping families navigate through this difficult time on every front.
So Jennifer, you talked about testing, and we know that Somerset ISD is eyeing a testing protocol. Universities have. I'm sure that Northside has made some considerations about testing. What are some of those considerations?
So we have, earlier in the summer, we did have kind of a partnership with the Metropolitan Health in providing areas for them to do some what they called pop-up clinics, where family members, whether they were Northside families or just anybody in the community, could utilize and come on to our facilities, and we would host that facility for them as they did the testing. That was free to those individuals that took advantage of it. And so we've had conversations about, if that need was to come about in a larger scale, if that we would be willing to talk with and discuss methods of that.
Sounds like, correct me if I'm putting words in your mouth, but with the onset of flu season and with the changing metrics, Northside that's on the table, that if necessary, you're going to be partnering with Metro Health and other organizations where if there's a need, Northside's going to address it.
Sure, we would definitely consult with those entities and welcome to have an open discussion about that if that's something that what could be done, because we want to make sure that there is adequate testing capability within the city. Right now, they have more than enough capability from what we've been told, which is a great thing, that they have the ability to definitely meet demand. And so if those type of numbers were to change, then sure, Northside has been very open about working with the different entities to help our community.
And I know we've kind of touched on it. We've talked about isolation. We've talked about parents getting with your healthcare provider. But if we wanted to kind of sum up a roadmap to give them A, B, C, D, if you suspect that your child may have COVID, what should be the procedure? What do I do?
If the parent thinks that their child might have COVID-19 or a member of their family might have COVID-19, the first thing to do is to keep them home at that point. If they would need assistance in finding a healthcare provider to reach out to, they can certainly contact their school nurse, who would be able to assist them in finding them that information. Other than that, it would be contact your healthcare provider and kind of just walk through the situation with them, and then they would make a decision. Yes, I feel like that maybe the individual in your house should be tested, and here is some ways that you can go about it. Parents can also, if their child is having symptoms and they know that they might be symptoms of COVID-19, then they can look onto the San Antonio Metro Health website about locations of clinics where they could possibly get free testing. And then their school nurse would be able to help them navigate that as well.
But I think the important thing that we're going to stress 2 or 3 times today, if your child is feeling ill, even whether they're running a fever or not, if they're feeling ill, it's in everybody's best interest that they stay home.
Correct. Yes, that we're telling them to stay home. That doesn't mean that they don't necessarily would participate in school, because we always have that virtual opportunity. They can still log in and see their teacher and their friends and participate in school if they're feeling well enough to do that. But yes, we want to make sure that if they're not feeling well, that we want to make sure that they're keeping for their safety, but then the safety for the everyone else at the school as well.
Jennifer, would it be impossible if my child was feeling ill and I'm at a little loss, not quite sure what I want to do, and maybe I'm having difficulty getting into my doctor or his office, could I not call my child student nurse or school nurse and say, hey, I need a little guidance here?
Mm-hmm. Yes, for sure. We invite them to call because the school nurses will be able to get them hooked up with resources if needed, answer questions. You know, if they has like, well, I'm not sure if this might be a symptom or not. Their school nurse will be able to assist them in that. And then, you know, some of our kids, we have students with asthma, we have and adults with other chronic conditions, or they may have seasonal allergies and things like that. So we've really encouraged our parents that if they do have those conditions to let the school nurses know, talk with their provider, you know, make sure they have an asthma action plan on file with them. If they have chronic seasonal allergies, that they have an allergy plan on file with us, and that all of that information, the school nurse can utilize that to help guide parents as to what their next steps would be.
Okay. What challenges has the district and the nursing staff faced?
Well, we've experienced quite a few challenges, and probably a lot of the challenges is that there's so much unknown, and so everyone has had really good lessons in flexibility, lessons in patience, and then so our kind of a buzzword we have is pivot. If we need to pivot, we're going to pivot to make sure we'll meet the needs of whoever, all our students and staff members and things like that. So that, and then we wanted to make sure that we're navigating logistically on each of our campuses. All of our campuses are very different, so we don't have just one whole plan that will work for this school versus this school. And so that part has been a challenge, but it's been a challenge that we have to meet, because we want to make sure that the planning that we do on each individual campus is going to keep those kids and staff members as safe as possible.
So 3 weeks into the process of in-person learning, success or no?
I feel so far we've been successful. You know, we are meeting the landmarks that we've wanted to meet so far. We are hopeful that through continued vigilance, continued education, continued reminders, and just being open and ready to make changes where we need to, I think that we have come a long way in those 3 weeks. We hope that it continues, that we can continue to open up as our plans would like. So on that end, I think that we've been very fortunate in that we've been able to meet the milestones that we've wanted to meet so far. We may not be moving as quickly as some other school districts in other states and things like that, but I think that being conservative and being patient and being very purposeful in how we do bring kids back and staff members back, that it's going to pay off in the long run. At least that's what we're hoping.
So the hard question, 2 parts to it. Considering where we were in May, June, July, and where we are now, did you foresee us being able to do in-person instruction?
That's a great question, because we were hoping to do some in-person instruction in first summer school, and that didn't happen. And so I think we learned some very valuable lessons, not only in Northside, but just as a city and a county, you know, what works, what doesn't work, and all of that. I was very hopeful we would be able to start having students in at some point, and I am thankful that it's September and we do have kids in school, because there was a lot of time we didn't know if it would be October, November, maybe even the whole semester, and so yeah, it's just so unpredictable how this whole pandemic has happened, you know, and we continue to learn every day. I don't know if I would have predicted that we would be as far along right now as we are, but I am very happy to be wrong about that, you know.
So this isn't fair of me, but I'm going to really put you on the hot seat. Being in the medical profession, being a registered nurse, seeing it on the bottom line, would you send your kid to the classroom?
If it were my child?
Yes.
I would.
Okay, why?
I would, because I am confident in the safety measures that we have in place. And I feel confident that the district is putting emphasis and its heart, for lack of a better word, in the right place, and that safety is the number one priority, and that we are not we're not afraid to say if something we need to look at that again, and we've done that several times. You know, we had a plan to go this way, and we're like, nope, that's not going to work. We're going to do this. And I think for that reason, yes, I would send my kids to school. But I also understand that there are other families that's not the right decision for them. And we totally respect that, because we want to serve our kids wherever they are and wherever the families are. And we're going to continue to be here, and we're going to continue to improve, and we're going to continue to offer a lot of things to help kids grow and blossom and get a really high quality education. So that actually wasn't a difficult decision or a hard question for me as a parent. My kids are a little bit older, but they both did go all the way through Northside, and I have family members in Northside, and so it's a difficult question for many. But if it were me, yes, I would send my kids.
And I've asked Dr. Woods, I've asked Dr. Machuca, I've asked Stan Lane, I've even asked Steve Chumley. What's the most important message that you want the people from Northside, the people from Bexar County, to have? What's the one thing that you want them to really focus on and understand?
I think the one thing is that we're ready for you to come back to school when you're ready. We're here. We're not going anywhere, and we want to make sure that you understand what we have in place, what we are going to be offering to both your students, maybe family members who might be staff members, community members, we are totally dedicated to the safety of all individuals involved. And so that's the one message that I want them to understand, is that we are here and we are doing everything that we can to make our buildings and programs and events as safe as we possibly can. And to know that there's a lot of thought that has been done already, but there's a lot of thought and planning and pivoting that continues in order to make sure that that's what we're going to offer and be able to do for them.
And if I need information, if events change, where is the best place to find that information? I
think the best place would be, we do have a good website, but we also have each individual campus leadership. If they have questions there and they want to talk to their campus administrator, or if they have a specific medical question, that yes, please do utilize your school nurse, that we have them on the campuses ready to go and answer questions. And if they may not have a specific answer, our department is here as well, and we're very happy to assist and answer questions there too. And if those questions we may not have the answer to, we definitely know who to go to. You know, we have a very good working relationship with our San Antonio Metropolitan Health District. We talk with them very regularly, daily, for guidance through epidemiology. And then we did instill our COVID advisory panel that was recommended from the Metro Health. We had a meeting very recently, and we'll be having some more. We're very fortunate to have some very wonderful physicians and people from other areas around the county, so we're very blessed in that, to be able to get some outside guidance as well, things to consider, not only from within our own leadership, but just to have this opportunity to either ask questions or and get some guidance on if there's anything that we can do better. We want to make sure we are doing that. So those resources, I think, are out there, and we don't want parents afraid to ask, because that's what we're here for.